Okay, I think we'll go ahead and get started. Thanks again for joining. So this is our virtual office hours. It's a monthly webinar that we host here from the City Health Dashboard, meant to be kind of an informal way to touch base with users, see what kinds of questions people have. We do a pretty brief introduction and demo of the dashboard. And then each month we kind of touch on a different topic, whether it's a new measure, partner sharing, how they're using the data. And today we're going to be focusing on small cities. Part of that is our currently open challenge, which is called the Put Us on the Map Challenge. So we'll answer questions about that as we go on here, but we'll also touch on some ways that smaller cities, meaning under 50,000 population, can use the dashboard just as it stands today. So we hope to touch on all of those pieces and answer any questions that you have about the site or the data. We usually have a pretty small group. Yeah, looks like today is not too huge. So as you have questions throughout, feel free to put them in the chat. We'll have plenty of time after we run through a little bit of intro of the site to answer any questions that you have. So feel free to be putting that in, and we'll check in to the chat. And you also can feel free when we get to the Q&A just to come off video and mute, and we can chat. So I'm Becky Ofran. I'm the Manager of Engagement and Partnerships here at the City Health Dashboard. We are housed at NYU School of Medicine in the Department of Population Health. And let me make sure my slides are moving here. Great. So at the City Health Dashboard, our goal is really to help cities across the US leverage the power of data to improve health and well-being in the community. And we do that by currently offering 40 measures of health, the factors that shape health and the drivers of health equity in order to really guide local solutions. We have over 750 US cities currently on the City Health Dashboard, and that is all cities over 50,000 population. And since this is geared towards small cities, if you are under that population threshold, don't go yet. We have plenty to talk about today for those smaller cities. The goal of the dashboard was really to bring a lot of the kinds of health data and the social determinants of health data into one view for city leaders. There's a lot available at the county level, certainly at the state level, but really when you get down to those smaller population geographies, we were hearing from city leaders that they just needed more data in order to put some of these health issues on the map. So the City Health Dashboard was created with funding from the Robert Wood Johnson Foundation and in partnership with our other research partners at NYU School of Wagner, along with the National Resource Network, the International City and County Management Association, ICMA, and the National League of Cities. And we continue to connect with partners and users all the time to make sure that we're providing the most useful data and tool that we can. So how can you use the City Health Dashboard? Really to kind of compare those health gaps across neighborhoods within an individual city. You can also compare your city to other cities in other regions or with similar populations. And you can set priorities and better target resources. This is just an example of the data for life expectancy by census tract in Columbus, Ohio. And these little blue shapes are census tracts or what we call neighborhoods. And these three census tracts right in a row, no more than 2 miles apart, really have quite large differences in life expectancy, ranging from a low here of 60 years life expectancy to 80 and then back down to 68, all in one kind of neighboring communities there. So our measures come from national data sets, and that's what allows us to be able to compare the same metrics across all the cities on the dashboard. So we'll look at a couple of smaller cities today, but whether it's Glassboro, New Jersey, or Pensacola, Florida, or Chicago, Illinois, the cardiovascular disease and broadband connection, and they're all measured the same way in all of those cities. So you can really compare apples to apples. Because we're out of a medical school of research and epidemiology department, We have a lot of rigorous methods kind of underlying the way that we select data and get it onto the dashboard. We also kind of curate the metrics that we display. So currently we have 40. Sometimes we add a few every once in a while, but we try to keep it a pretty curated list that reflects public health priorities. And importantly, we also want the measures to be amenable to city level intervention. So while sometimes states have power to take certain action in counties, and the data can be useful across those areas as well. But we really wanted city health departments and mayors and community groups working to sway those kinds of city leaders to be able to be looking at data that they can make a difference on. We do update the data regularly, and the measures are balanced across 5 domains shown here. So we're looking at a lot, but these are the 5 domains. I'm not sure if you can see my mouse, so the 5 domains have, and then all the metrics are listed out here. And in terms of the color coding, measures shown just in dark blue are available at the city level, and measures in gold are available at the city and neighborhood level. So now I'm just gonna hop over to the site. 1 second. Okay. Just make sure I can see everything here. Okay, great. So the site is freely available at cityhealthdashboard.com. You just need an internet connection to get there. And it's set up for you to dive right into a city and find your data. But there's a lot more to look at also. Just as you scroll down the page, we highlight some events, research, how others are using the site. Just to kind of point out some of the other features, there's a lot of great stuff to explore. But diving in, I'm going to select Glassboro, New Jersey here today because it's about 2 miles from where I grew up. So this is a small town in New Jersey. It's actually under 50,000 population, and I wanted to kind of show it today because we did a pilot that my colleague Sammy will talk about a little bit later with New Jersey Health Initiatives to add 10 small communities in southern New Jersey that were under our population threshold of 50,000 to kind of test what data can we get at that level, how can we work with these smaller communities. And the 10 small communities that we added were between about 2,500 and 30,000 population. And Glassboro is one of those cities. So we'll kind of show what data looks like for a smaller city on the dashboard before we get into how other small cities can be added to the dashboard. So again, this is the metric list. It should look pretty familiar. And if you know where you want to jump in, you can just select a metric and go there. But you can also scroll down and go to this city overview. And this kind of starts you on the site moving across this navigation ribbon at the top. But it's meant to give you an overview of how the city stands on all the measures of the dashboard. And just to kind of orient you here, if you click one and open it up, you can kind of see that the gold bar is the value for the city that we're looking at. So diabetes in Glassboro is about 9.2% of adults report having diabetes. And that's just below the average of all cities on the dashboard at 10.3, which means that Glassboro is doing a little bit better than the national average. And I use quotes because it's not quite the national average, but it's the national average of all the cities on the dashboard. This little green check mark is here when the city is doing better than that average. And then you can see the range of values within the city. So diabetes rates range from 3% to 12% within Glassboro. And across the site, lighter colors indicate better outcomes. And so this check mark here is kind of showing you that's the direction of better outcomes. And darker colors indicate poorer outcomes. So it shifts based on the measure that you're looking at, but that's just kind of a helpful signpost to as you navigate the site here. So just at a glance, we can see where Glassboro is doing better than the national average and where there's room for improvement. And then so this city overview shows you all the measures. And let's just click through here to get to the metric detail page for children in poverty. So again, to kind of orient you to navigating the site, we're looking at children in poverty for the year 2019. That's the latest year available for this measure. And the most recent year available will vary based on what measure that you're looking at. But you can always click here and see past years of data if we have it. And again, those past years will vary a little bit based on the metric. This more about the metric is a very useful area. People often ask, well, where does the data come from? What is this measure coming from? And we have all of that detail here. So children in poverty, we pull from the American Community Survey. It's a part of the census that's done every year. And we calculate it by taking a 5-year estimate. And it's available at the census tract level and broken down by demographic groups. And I'll go to this later, but the complete metric information can be really useful to explain how any of the measures on the site connect to health. So children in poverty is, people are a little bit more aware of the links between poverty and health, but for a measure maybe like broadband connection, one of our newer measures, sometimes making that link, if you're trying to show why it's important to your local health office, we've helped to make that link for you. So then as you scroll down, again, you can see that scale bar, and we have a little sense making statement to help you kind of translate the numbers in the graphic into a sentence that everybody will understand. So just over 22% of Glassboro's children were in poverty that year, compared to an average of 19% across the dashboard cities. And then as you scroll down, so we can see here, again, these shapes are the census tracts, and this is the map of Glassboro. So we see how children in poverty really varies across the city. This lightest color here, only just under 6% of children were living in poverty, but the census tract right next to it is 36%. And here's 22%, 15%. So you can really see that variation across the city, and anybody living there familiar with the city might start to recognize some of these patterns and neighborhoods and start to ask the questions, why is this like this? If I lived in this neighborhood, would I have better access to schools or whatever it may be? You can begin to ask those questions with everybody really looking at the same data. And then moving into demographic detail. So this isn't available for all measures, but this is one of the measures where the demographic breakdown is available. And so here we're looking at children in poverty citywide in Glassboro, broken down by racial and ethnic group. And we can see that there is wide variation. White children, the rate of poverty is only 4%, while for Hispanic children it's 30%, Black children 50%, Asian 33%. So we can see there's a lot of work to do there to reduce disparities. And then comparing cities. So this feature can be helpful when you are, perhaps there are cities where you tend to kind of compare yourself because you're in the same state or similar in size. And so you're kind of always compared to them. But say you want to explore other cities so this will be unique because it'll be our smaller cities, but that are in a similar population range. And maybe that have a similar Black population, a similar size Black population. That brings us down to 11 cities all across the country. And that might be an interesting way for you to see, okay, how are these other cities doing on poverty? What can I do to compare with them and just see what we can work on in our own city. And then lastly, just to point out here, we have this compare metrics feature that allows you to look at two metrics at the same time on one map. And it's a little bit harder with small cities here, but so what we're still looking at is children in poverty in the blue census tracts. And now I've selected diabetes as the pink and red dots to overlay on top. And again, lighter colors indicate better outcomes and darker colors are the poorer outcomes. So the darker shades of red for the dots means that there's higher diabetes rates there. And we do see that the diabetes and poverty kind of trend together just at a really kind of visual glance here. The lower rates of diabetes tend to be in the census tracts where there's less poverty and vice versa. As you scroll down, we also show this on a scatter plot, but again, it's kind of hard to see with only 5 census tracts. But in other bigger cities where there's a lot of census tracts, you can see how those patterns kind of trend together or not. So that's just a quick overview of kind of the navigation of the site. All the data is downloadable. As you go over here to the main menu of the site, you can access dashboard data and download all the data as a CSV file or access an API to pull all the data for all cities across the site. And then just as we're over here on the main menu, you can access a lot of other great information like our take action section, which I'll talk a little bit more about in a second. Our impact stories, which is how others are using the data to make change in their communities. We have some great blogs that kind of explain, sometimes we'll do a behind the metric or explaining other helpful information about the site. So again, lots of great ways to explore there. So in terms of small cities that are not on the dashboard, how can we use this? So there are still great ways to use the site. So I mentioned the metrics background or one pagers. So you can access these from the individual pages of the site. But as you expand these, you can also see all of the pages are listed out here, the metrics. So you can click this. And so this is what we call our one pagers. And this is where we've kind of shown, why do we measure this? How do we measure it? Kind of the strengths and limitations to consider, and really making that link to health. Again, let me pull up. So here's our broadband connection one pager. And this is just a good example of a measure that a lot of people might not connect to health, but we've done that connection for you. So for smaller cities that are just kind of exploring, or maybe they know that there's an issue that they want to work on, and are looking for some language to help frame it for their mayor or town council. We've done this research for you and put it into these handy documents with resources and everything, and references so that you can help make that link for the people that you're talking with. Another piece of the site that's really useful if you don't have data on the site is just those impact stories. So going to this section of the site, this is where we share a couple of stories about how other users are using dashboard data, whether it's on the site itself or using the downloadable data. It spans from educators, college professors and students using the data, to health departments, and lots of other examples of how you can use data, whatever data it is. We've tried to curate city level data for everyone, but just to show how impactful it can be to use local data to make change in communities. These can inspire some of those stories for you as well. And then lastly, I just wanted to point out the take action section too. So here, it's on the navigation bar up here, but you can also access it from the main menu. But our take action section is where you can go. If you've looked at your data, great. You've been able to see, wow, this is where we have some gaps and areas to work on. Now what can I do about it? But even if you haven't looked at the data, but you know from living in your community, these are the issues that we want to work on, that we're concerned about, what can we do about that? So this policies and programs section of the Take Action page here points to a lot of curated resources that can be filtered for individual metrics. Right now it's filtered for diabetes because that's one of the measures I was looking at. And we pull here from kind of trusted resources that are doing heavy research on like really what works for health. There are some programs here from City Health, the Community Guide, County Health Rankings and Roadmaps. So some great resources for you to explore. There's sometimes draft policies that you can do. So it's a great area to look even if you don't have direct access to the data. So I'm going to pause there and hand it back to Sammy. Sammy, do you want me to just run the slides or?
Yeah, whatever is easier. I don't mind pulling them up on my end too.
I got
it. Okay, thanks, Becky. So as Becky mentioned, the focus of the office hours today is on the Put Us on the Map challenge. But before we get into that, I do want to take a step back and kind of explain the evolution of how we got to where we are and why we're providing this opportunity for folks in small cities. So when we launched the dashboard in 2018, it was always our goal and our hope that we would be able to provide our data for smaller places. And really since launching, we've tried to create opportunities where we can continue to expand our site to smaller cities. And in 2019, we got the opportunity to do that through a partnership with the New Jersey Health Initiatives. If you want to run the slides, Becky. Which NJHI is a grant-making foundation in New Jersey, and they funded us to identify and add 10 small cities in southern New Jersey, as Becky mentioned briefly. And so all of those cities were under 30K, with the smallest being I think around 2,500 or 3,000. And in conjunction with us adding the data for those cities, NJHI also funded cross-sectoral teams, or dream teams as they called them, or folks that were tasked with looking at the data, exploring metrics on the dashboard and identifying community challenges, and then working together to develop local solutions to improve community health and equity. Next slide. And in Glassboro, that team was led by 2 professors from Rowan University, which is a local university. And that team was comprised of undergrad students and community members. And using dashboard data, they were able to identify poverty and healthy food access as 2 challenges that the community was facing at that time. And so using that data as a guide, the team then administered surveys, organized focus groups, held interviews with community members to understand the real lived experience and how residents were affected by food insecurity. And so the results from that work, coupled with our data, drove recommendations for how the city could improve food access generally, but also healthy food access. And since we launched that, or since that project launched in 2020, those recommendations have since been presented to local government officials as well as the greater community. Next slide. So that brings us to the Put Us on the Map challenge. And so since we launched that program, like I said, in 2020, we have really wanted to figure out how we can bring that opportunity to more cities across the country, not just in New Jersey. So the Put Us on the Map challenge is how we're doing that. It's a new free opportunity for residents and local governments from smaller cities to apply to have their city added to the dashboard. And around 10 cities will be selected and added in July 2020. Next slide. So who can apply? We wanted it to be, broad where we could get a lot of cities and a lot of folks from cities applying. So US municipalities with a population of 3,000 to 50,000. And when we say municipalities, we mean cities, towns, boroughs, townships, and villages. So not just what people think of as a typical city. And individuals or teams represented by policymakers, city government staff, students, teachers, community members are all invited and encouraged to apply. We love when, really diverse people are using the dashboard in their local work, because it's always inspiring to see the different ways different people approach our data and approach local solutions with our data. And the last point, partnerships showing cross-sector or existing cross-sectoral collaboration will be seen as a bonus. But of course, that is not, a rate limiting step. Next slide. And what will you or the selected cities get if selected? So the first and the most important thing for me is just access to your city's data on the dashboard website, as well as all of the dashboard features that Becky just went into in her demo. And while we're not able to provide all 40 of our measures for smaller cities just due to limitations of our data sources, we will be able to provide a majority of our measures. So 26 measures will be available and accessible for anyone and for all of those cities. So things like broadband connection, COVID risk, excessive housing costs, life expectancy. This is still a really comprehensive, diverse list of measures that get at public health and help us understand what community health and the drivers of health look like across our cities. Second, support from the dashboard team, whether that's technical assistance to help users, understand data, understand what we're measuring, how we're measuring it, but also support on how to use the data and how to and any practical applications for leveraging the data in local work. And then finally, a featured blog or impact story on our site. We love hearing and sharing stories of how people are using the data on the ground. And so this is an opportunity to get published on our site through either a blog or an impact story, which is like a smaller case study. So next slide. So how to apply the nuts and bolts. We have a very, very easy application form. We did not want to create, a lot of barriers for folks who are interested in getting their cities on the map. I think there's like 10 questions on the application, and quite a few of them are pretty easy. It's your name, your organization, the city you're from, those questions that would get you 500 points on the SAT. But the most important part of the application is to tell us why local data is important to you and your city, what you hope to accomplish with the data, and how having access to data will make a difference in your community's health. And one important note is if the applicant is not from city government, which is totally fine, we do ask that those groups or that person submits a letter of support from a partner within a city department or a city government department. And we provide a template for that on our application. And again, we do not want that to be a barrier. So we really have made it as easy as possible to complete that template or complete that letter. And then finally, applications close on February 28th at 5 p.m. Pacific time. So we have, I think I checked it, it's 12 days from now. So we still have a lot of time to get your applications in. And like I said, the application is not meant to be, a real challenge. Shouldn't take you too long to submit. And next slide. And just a brief kind of high level overview of the project timeline. Like I said, applications close February 28th, with the selected cities getting announced in April. And then the cities will be launched on the dashboard website this summer in July with a webinar, a very special webinar, or kind of similar to this office hours that are just for the selected cities in August, where we'll explore the data and we'll explore, what challenges or opportunities folks kind of identified in that month or two or in that month, excuse me, of kind of exploring the data. And then we'll, brainstorm ideas for solutions and discuss how folks plan to maybe move the needle and get things done in their city. And then support will be ongoing for those selected cities. And with that, I will open it up to questions. I know that it's a lot of information that was just thrown at you, but feel free to enter your questions in the chat or just hop off mute and just start talking.
Thanks, Sammy. And I did just want to kind of show the application here for folks. We'll share the link for it in the chat, along with the blog that kind of explains everything we just went through. But as you can see, it's pretty basic. Just asking for kind of some identifying information, the city that you want to add, and then kind of getting into those questions of why data is important for your city, how you envision using it, any active partnerships, and that's basically it. So we're really excited to get these cities added this summer.
Thanks, Becky. I think my keyboard just died, so I'm not able to put the links in the chat. So if you wouldn't mind doing that.
Yep.
But there it goes. We did get a question. Are you looking? This is from Melissa. Are you looking for a specific project and how we envision using the site and data? That's a great question. So while we're not looking for a specific use case of our data or a specific project, we are, once we get all of the applications in, we are going to kind of see the different ways people are aiming to use the data and choose accordingly, because we want to have a diverse set of use cases or a diverse set of projects, if possible.
Hey, this is Rebecca. I just wanted to touch base real quick. We are the Marietta Belpre Health Department, so we serve 2 separate cities. So do I fill out 2 applications then? Because those 2 would be totally different population estimates that we would do. And I mean, all of the biggest reason I am very interested in this is because we're working towards through accreditation. I don't know if there are any other health departments on here as well, but everything that you look at for statistics and data is all county or state based. And with these smaller cities, first of all, thank you very much for providing this opportunity. We got this information for this from our local mayors. So I am very excited to fill out, but that's the biggest question I have right now is, do I fill out 2 separate applications?
Yeah, in this case, because it would be 2 different cities, you can do 2 applications just so we have both cities kind of in the system. But then you can, refer to the
or copy and paste the
yeah,
for the same
we needed
reasons.
it. Yeah.
exactly.
All right, awesome. Thank you.
Thank you. Will the application be mailed to us? So great question. I can definitely email you, Jennifer, after this call. We have sent out a couple emails with the application included in that. So I can, so if you are not subscribed to our website, I highly suggest doing so. I can drop a link to do that here. But if you do need it, I can forward that along after this call. Any other? I'm just looking at the chat. Nothing coming through the chat, but again, feel free to just unmute yourself.
And if you're not sure about filling out the application, or you need to talk to this, other partners first or something, we are planning to close it on the 28th, and you're not committing to much besides working with us and kind of, attending the webinar and everything. We had this question come in by email earlier this week. I would say put in the application, and then if you really need to withdraw or something for some reason, if selected, then we can do that later on. But it would be great to get it in before the 28th.
So we just got a question from Marta. If selected to be part of this program, is there a time frame for which technical assistance and other support will be available, or is it indefinite? And will there ever be a fee associated with it in the future? So the answer to the second question is no, there will never be a fee associated with having your data on the dashboard. Once it's there, and it's free, accessible, indefinitely, forever. And in terms of TA and other support, we are always here to provide support really for anyone from any city who writes into us. For those, ad hoc, smaller in scope, data asks, we are happy to always cut data files for users. Obviously, that's dependent on, and again, we're happy to offer our time, but if it's something, very specific or, longer in scope, that becomes a little bit harder just based on our analyst time and our staff time. But just for general support and general technical assistance, we are, always here to offer that for free.
And also in terms of the second question, just thinking about the data being on the site. So once your city is kind of incorporated into our universe of cities on the dashboard, whenever we're doing data updates, and as we are able to get data for the measures that aren't in this first group of this first set, they will be added over time. So you're kind of just incorporated into our data infrastructure. So I hope that helps. Any other questions? Great, so we'll hang out here for a few minutes. And I'm just, Sammy's email is all over the application, but I'm going to type it in here too. So as you're filling out the application, if you have any questions, or if you have any questions in general about the dashboard, please reach out to us. We're happy to help you through this. Again, it's meant to be a very accessible way to get your city's data on the site, and we're excited to work with this new group of cities. So we'll stay here for a minute in case anybody has a final question that they're shy to ask, but otherwise we look forward to being in touch with everyone in the future. And keep an eye out on our events, and we do these virtual office hours monthly. It's kind of always a little bit of a different topic, and you're welcome to come every month if you want. So we'll see you all again soon. Thanks so much.
Did you mention how many cities will be selected? Yes, so around 10 cities will be selected.
Is it okay to chat with you guys now?
Yeah, of course.
I didn't want to hog the whole thing. I didn't want to let somebody else talk too.
Hog
I
away.
am working on the application on one screen while I've got y'all on this one. I've looked at this when I first started working with the city health department, looked at the city dashboard. Of course, this Marietta city but we have 13,385. So did I miss that there was a cutoff for the number of population?
The cutoff is 3,000, so you're good.
Okay, and I know Belpre, I think, has probably around 8 or 9,000. So both of those cities would possibly be beneficial. This service would be okay.
Yep.
But
and what state are you working from? Just
Ohio.
Ohio, great.
Okay.
Great. Yeah.
But Did I hear you were only choosing 10 cities though?
Around 10, yeah.
Okay,
If we get, a lot of applications, maybe we'll extend it, but yeah, we're aiming for 10.
okay. Okay. All right. Well, I'm going to work on my application here and
Great.
thank you very much.
And Rebecca, just do mention, because for the 2 cities, mention in each application, like this is, it's a pair of cities.
Oh, okay. I didn't
Yeah.
think about doing that, but let's see. Well, the organization, name of organization or city health department. I will put Marietta / Belpre Health Department
Yeah.
there. Okay.
That works.
Perfect.
Great.
All right. Thank you.
Yep, thank you.
We look forward to reading it or reading them.
Well, hopefully I won't sound too needy, but I am.
That's okay. We want to provide this data to as many cities as possible.
All right. Thanks, ladies.
Thanks a lot.
Thank you. Okay, if no other questions, I'm not seeing anything in the chat, and I think most of us have left, so I will end this office hours, but thank you guys for attending.
Thanks, Sammy. Bye.
Bye.